We're good to go? Alright, today we are neutering this approximately 2 to 3 year old intact male lab mix. He is in, again, dorsal recumbency, meaning he's laying on his back with his belly in the air, and his scrotal area and testicles have been shaved and surgically prepped. Again, using sterile surgical equipment in order to keep everything as clean as possible. For the safety, health, and well-being of our patients. And neutering or castration in male dogs is recommended when they are young for behavioral reasons, to prevent them from urinating to mark their territory, or attacking other dogs, or leaving home to try and find ladies. And so we're doing that today for this nice dog. He's a little bit older than what we would normally recommend, but he was a foundling, so we will handle all of that today. So the incision is called a prescrotal incision, meaning that it is in front of the scrotal sac, and it is made just large enough to barely squeeze the testicle out of the incision. And the soft tissue is broken down by stretching and tearing, as mentioned in other videos. The stretching and pulling of all of those little tiny capillaries causes them to skinny down and clot on their own without having to be individually ligated with a lot of suture. So it leaves less suture behind in the animal while still controlling bleeding. So we break down as much of the non-vessel tissue as we can, and we are left with the spermatic cord and some muscles, and of course all important vessels that we are going to clamp off and then tie off using our favorite knot, the Miller's knot. There are 2 different ways to neuter a male dog. You can do what's called an open castration or a closed castration. Today's video is closed castration, as I re-macrame my string. Okay, so again, using sterile, absorbable surgical suture so that it is broken down by the body within 3 to 6 months of placement, long enough for the tissues to heal and to control bleeding, but not so long that a permanent inflammatory response occurs in the body, which is what happens if you use non-absorbable suture and leave it behind. So there is our first ligation. This is quite thick tissue. We do a series of 2. And using the Miller's knot both times. And what can make it easier is if you have crushed, you can then tie into the crush area where your clamp was, if you can get it to go. There you go. And it's already nicely squinched down for you. So the Miller's knot, again, is a crushing as well as ligating knot that allows you to smush through non-vascular soft tissue that is surrounding the vessels without having to totally get rid of it before you start ligating. We remove the first testicle and place it in the stump, watching for bleeding, no bleeding, back inside the incision. Now, unlike a spay or abdominal surgery, this is a skin incision only. It doesn't go into the abdominal cavity, although the scrotal sac does communicate with the abdominal cavity, which is why it's important to ligate those vessels. If they were to bleed freely, he would simply bleed into his abdomen and could bleed to death by bleeding inside his abdomen. So we do the same thing on the opposite side. And try and convince the dog that he really wants to let go of his testicle. It feels sort of like popping a zip. And up and out. And again, same thing, opposite side, breaking down all of that stretchy connective tissue until you're left with muscle and vessels and spermatic cord and a little bit of nerve. So our patient is anesthetized so that this is not painful while it's going on. He had a pre-anesthetic medication which not only made him feel sleepy and calm, but also started to block the pain receptors or nociception in the body. And it's important, we now know via lots of research in animals as well as humans, it is important to stop pain before it starts, because once the pain neural pathways get triggered and pain signals start to be sent, it is harder to stop them once they've started than it is to block them before they ever even start signaling. So before the dog ever undergoes any sort of surgical procedure, we start pain medications beforehand. The induction agent that we use also has pain medication in it that will last for several hours, and there's a 24-hour anti-inflammatory pain reliever that he was already given as well while he was under anesthesia, and he will go home with several days worth of oral pain relievers for his owners to give at home. So both testicles have now been removed, and we're left simply closing up the incision. So little tiny puppies. The incision can be as small as the size of a pea. In dogs with full-grown testicles like this gentleman, it has to be larger to accommodate the removal of the testicles. So again, since we are not going through the abdominal cavity, we don't have muscle to suture together, it's just the subcutaneous tissue or the under the skin tissue and the skin itself. Both layers are important to decrease the amount of swelling at the incision site, and also, again, because if there were to be any small bleeding, little small amounts of oozing blood from the cut tissues, it would stay kind of isolated in the scrotal sac and in the scrotal area and not make its way into the abdomen, and the pressure of bleeding into a closed sac allows clotting to occur on its own much more readily. And as with other surgeries, when we can, we like to use sutures that stay under the skin or subcuticular so that they do not have to be removed later, giving the dog less opportunity to lick at the incision out of discomfort and less opportunity to allow bacteria from the outside of the animal to wick down into the living layers of the skin and cause infection. So it is also more convenient and leaves a more aesthetically pleasing tiny white line of a scar rather than the centipede/railroad tracks that most people are familiar with in people or animals that have had external sutures that then had to be removed later. So the main healing issue for this guy is going to be not licking his junk, which is a challenge for most male dogs, whether intact or not, no matter how old. So we will also place some nasty tasting ointment right around the incision, so that the first thing he will do when he wakes up is figure out that it's not worth his time getting that nasty tasting ointment in his mouth by licking at his newly removed balls. So we will bury this knot slowly but surely. And surgery is complete, so now we will be non-sterile and put the nasty tasting, although sort of nice smelling ointment all around the shaved and cut area to deter licking. And because we shave the scrotal sac, we put it on there too, so that it doesn't feel weird and make him want to lick it right after surgery. And I think that's it.